Hey, everybody, welcome to episode 454 of our Tick Bootcamp podcast. I'm here today with Dr. Andi Campitelli, who is from Toronto, Canada, and we're going to have some really cool topics here to discuss. But I first wanted to share that if you're looking for some free resources for the Lyme community, you have to go to our website. It's drandind.com. So that's drandnd.com, drandnd.com. She has a free intermittent fasting guide, a free Hormones 101 guide, and also a clean keto eating ebook as well. And there's some great content there that I've looked at myself and is going to help everybody in the Lyme community. So with that, Dr. Campitelli, Dr. Andi, welcome to the Tick Bootcamp podcast.
Thank you. Thank you so much for having me.
So, Dr. Andi, I'd like you to start, and I know this is kind of weird to start all the way back when you were a kid, but tell us what life was like as a kid and where you grew up before you became the famous Dr. Andi.
Sure. I actually love that question. So I grew up in Pickering. So it's a city about 20 minutes east of Toronto. And I would describe my childhood as, happy, typical childhood. I'm the youngest of three kids. Both my parents were teachers. So just kind of the average, happy childhood outside all the time, playing. And my memories of growing up in my family are nothing but positive, and I'm very grateful for that.
So no trauma, no abuse, no chronic illnesses, nothing noteworthy that was negative that could have been immune suppressive or been a precursor to illness later on in life.
So not until I was 8. And this is actually what sort of steered my path towards really becoming or determining what kind of doctor I wanted to be. So I've known that I wanted to be a doctor since, according to my mom, since I was 3. And when I was 8, my father passed away.
Sorry.
So thank you. So I was 8, my sister was 10, my brother was 13. And my sister and I were home alone with him. He had a heart attack. My mother was out grocery shopping. He wasn't ill, very unexpected. He had no symptoms. And we came to find out later, and he passed away that same evening. We found out later he had undiagnosed arrhythmia. And so that is sort of what stemmed my passion for preventative medicine, longevity medicine, and really trying to sort of dig deeper because there were no signs or symptoms. So he was 40 when he passed away, healthy, no signs or symptoms. He was a principal. There's really nothing that would have indicated, or at least he hadn't said, there were no symptoms that would have indicated he was unwell. And so that really sort of sparked my passion. How do we prevent things like that? How did that happen? How did that go unmissed? We had a family doctor at the time. And so that's really what steered me more towards the naturopathic medicine side of things, to really start investigating how do we promote longevity? How do we catch those things before that happens? So I would say that was a really big driver with respect to the kind of medicine I wanted to practice.
So 8-year-old Dr. Andi is thinking, how can I get into preventative medicine to prevent people from having a heart attack at 40 like my dad? And you're 8 years old having these thoughts. That's also super rare as well. So I feel like that's a sign of who you are and what you are today.
Right. I knew, apparently, again, according to my mom, from the time I was 3, at 3, I wanted to be a singing brain surgeon. I asked her if I could sing opera in the operating room, and she was like, sure, sure. And so the kind of doctor I wanted to become has definitely changed. But yeah, 8 years old, and that was it. And you grow up really quickly when you experience trauma. So, you go from being an 8-year-old child to an 8-year-old adult, essentially. That's kind of what happens when you experience those things in life. And so it just sort of changes overnight. So I became 8-year-old little Dr. Andi, and I was like, well, this is what I'm going to do. And sort of that kind of has guided my path essentially since that time.
Any other noteworthy events throughout your childhood up until the time you went to college?
Honestly, I would say that was probably the biggest thing. I was, again, very grateful, very lucky. I had a really loving family. My mother was really supportive. She was a stay-at-home mom at the time. She went back to work after my father passed away, but she was a teacher. And so we were able to stay in our home. I was a dancer. I was able to continue doing ballet. So it really, my mom, I will say that the most significant thing I remember is how well my mother managed that, because she and my father had a really beautiful relationship. So she was quite devastated with his passing, and I would really say has never gotten over it. But I have to say, I credit her for how she parented us during those times. And I would say that was also a very strong influence. She was just a very strong woman, and she taught us how to go through adversity, love, strength, but we can do anything. And so my my life motto has always sort of been, I already dealt with the hardest thing in my life that I'll ever experience. So I can pretty much do anything from here.
So talk to us about now you're getting ready to go to college, you're
Mhm.
graduating high school, and you still have this doctor mentality. And now you know you want to do
Mhm.
preventative medicine since the time you were 8. Where are you going to college? What are your thoughts and what happens as you transition
Mhm.
from, a teenager to a young adult?
So I knew I still wanted to go into medicine. At the time, though, at that time, I wanted to be a medical doctor. I wasn't really familiar with naturopathic medicine when before I started my undergraduate degree. So I, wrote the MCAT and was doing all of those things to prepare to apply to medical school. Um, and then the summer before applications were due, or we'd have to start our applications, I met a naturopathic doctor. And actually, one of the reasons for going to see her was because I had had a lot of health symptoms. From the time I was about 17, I had terrible digestive symptoms. I had seen a million doctors. I'd been given, a million and one prescriptions. And then in my second or my third year of university, I did an exchange in France, where you do your third year of sciences at a university in France. So I lived in Lyon, France for a year. And I went to the pharmacy one day and I just said, "No, I can't handle these stomach aches anymore. Like, I don't know what to do. And what can you give me?" And the pharmacist in France gave me a digestive enzyme. And I thought, oh, okay, well, what's that? And I took it and it kind of helped. And so I came back home, and that was the summer where I was about to start applying to medical school. And I took it to my family doctor, because now we're kind of 5 years into trying to figure out what's wrong with my digestion, a million and one prescriptions. And I said, no, here's this French digestive enzyme that this pharmacist gave me. And it actually kind of helped. It's the first thing that's ever helped in all of the years we've been trying to figure out, like, what is wrong with me. So she took it, she threw it out, and she gave me another prescription. And I was like, huh, that's not the answer I was looking for. So that was kind of the first thing that started opening my mind to thinking, maybe there's a different kind of medicine or a different way of medicine that I'd like to practice. Because nothing she had done was working. Why is she throwing out the one thing that had worked? And so I went to a career fair at my university and I met this naturopath and I went to see her. And literally in 20 minutes, she's like, "Oh, you're lactose intolerant and gluten sensitive." And and I said, "Please don't tell me that that's it. Please don't tell me I've been suffering for 5 years and that's my only problem." She's like, "Yeah, that's your only problem." And she was right. That was it. That was it. I was just and it was mind-boggling because it was such a simple answer and no one had even brought it up. I just I,
Dr. Andy, I want to learn more about what you're learning in college because a lot of what you're
mm,
sharing was from personal experience. But what were you learning while
mhm,
you're in college about these things, right? Because you're studying
mhm.
a similar topic. And how was it in contrast to what your personal experiences were?
So this is the interesting thing about your undergrad. So I was doing biomedical science. I tried to double major so I tried to double major in French and science, and then I tried to minor in Spanish. But I was able to major in biomedical science. I got the minor in French, um, and it's interesting because when you're learning those foundational science courses, I took nutrition courses, I took all of those things, but they don't teach you how to approach, health in that way. It doesn't really teach you, how to dig a little deeper. That's not really what your undergraduate degree is about. It was all physics and chemistry and calculus and all of those things. But it wasn't something that taught me how to think a little bit outside the box or to start considering other things. And I did have a very big focus on nutrition from a very healthy family. As I said, I was a dancer and then I was a personal trainer and went into martial arts and all of those things. So very active. Um, but it just wasn't something that was on the radar at that time. So there was nothing that I was learning that would have made me think that that was it. And I think because it only started when I was sort of 17, it also didn't cross my mind because people assume, if this is something, if I'm gluten sensitive or lactose intolerant, why didn't I have it my whole life? And that understanding at that time for me, for sure, wasn't there. I'm 17, 18, 19. I had no idea. So it wasn't until I was about 21 that we just figured it out within 20 minutes. And it was that visit with a naturopathic doctor. And I thought, okay, I need to do something different here. This is just, and that was the day I decided to switch. And I decided naturopathic medicine was the route that I was going to go. Although, as we were chatting about earlier, I have come full circle.
Yes.
And, yes.
But Dr. Andi, there's two important things here that seem so simple to
Mhm,
us, but frankly, if you spoke to
mhm,
me years ago, I wouldn't have fully understood this, even when I was extremely chronically ill
mhm,
and bedbound, right? Which is
mhm,
if you're having digestive issues or GI related issues and you're listening to this podcast, digestive enzymes might be an appropriate tool to try to help get some relief, or also looking at food sensitivities, like you said, being
mhm,
lactose intolerant as well. And for you, you got some relief
mhm,
from digestive enzymes, which are a great tool to help, digestion and your gut microbiome, which are really important. I'm sure we'll get into later. But also
mhm,
identifying foods that trigger your symptoms, whether it be GI related or even inflammation and pain related, because there is a correlation that we've all experienced when we think about it from foods that exacerbate the symptoms that we have with Lyme disease. So I think you're highlighting some important tips here, just
mhm.
that are simple, free tools we can all use to think about these things in our everyday lives. So thank you for sharing
And
those two particular
no,
points.
no problem. And I actually think, because I can only, when you think of how long I went consuming those foods and the damage I did to my gut, because it then did take me years to heal my gut after that, because I had been consuming these things that my body just couldn't handle. So the inflammation in my gut. So I was doing, I mean, it took me a while to actually heal my gut to the point where I wasn't bloated every time I ate, a grape or something like that. So it took some time to heal, but I do think that that also set the stage for why I became symptomatic of Lyme, um,
Yes.
because of the gut disruption for so long in that time period. I think that we were starting to set the stage, because there are people walking around with Lyme disease who are completely asymptomatic, and then there are people who are bedbound and everything in between. And so there are all those factors that contribute to how our symptoms express themselves. So that was, I think, kind of the start of Lyme symptoms.
Excellent point. And I love this because now you're getting into preventative medicine, which was your interest since you
Mhm,
were 8 years old, where maybe if we had some more preventative measures that were common
mhm,
sense preventative measures that simply we don't hear about in school, never mind in medical school, right? Then we wouldn't be
mhm,
as sick as we were, both you and I personally. And we're going to get to that for sure. But let me ask
mhm.
you just one quick question. Why do you think you didn't start having GI issues until you were 17? Why do you think it took that long for them to present?
It's a good question. And if I go back that far, I think, and I try to make sure I'm doing it in the right chronological order. I think I got food poisoning before the onset of those symptoms. And I see that so frequently. And so lactose intolerance, I mean, so many people are lactose intolerant, and that can develop really almost at any stage in your life. But I think for me, I think the start was that I got food poisoning. But when I ask my mother and I go back to childhood, my nickname for my brother was Chubs. And there's a picture of me in a Halloween costume, and I'm a bee, and I'm sitting there, and I have my brother, as my brother says, a little boiler. I have a little gut. I'm 3. So when we go back to, and again, I was raised in a very healthy family. My mother was very health conscious. We were active. We ate well. But if I go back to photos, I was just bloated my whole life. And I just don't think anyone really thought anything of it. And it wasn't causing me pain at the time. The pain didn't start till I was 16, 17. And that's when I started investigating. But when I look at it, I actually think I had been lactose intolerant and gluten sensitive from the very beginning. And we just didn't know.
Yeah, and as you went on in life, potentially we're using antibiotics, environmental toxins,
Mhm,
all those things that make you more
exactly.
sensitive, and then you had more
Mhm.
pronounced symptoms of lactose intolerance as you got older, potentially, right? I think that makes complete
It,
sense.
Absolutely. And I think that the things that helped me were because I was raised in a family that was very healthy. So we weren't really predisposed to eating unhealthy foods. We didn't eat a lot of, grains. We didn't eat a ton of dairy. I wasn't drinking glasses of milk, but we'd have a little bit of cheese on something, or my mom would give me some whole grain crackers. But again, the diet was very healthy overall. And then I became very health conscious, and, I started intermittent fasting long before that was popular. So, I wasn't eating breakfast. So I was doing all these things, and I think were benefiting my gut. I just didn't know. And then as I started to learn, and then really got to a point where, healthy diet wasn't really enough to keep those symptoms at bay, and other things needed to happen and other things needed to change.
So, Dr. Andy, I sense that although you're going to be a doctor, between all these little things, these touch points throughout your life, you're having
Mhm.
the realization that hey, maybe I should look at natural medicine and make a pivot. Is that what occurred while you were in college based on all these experiences you described?
Absolutely. So I had always said, the kind of doctor I wanted to be, I'm going to spend an hour with my patients. And this is before I knew much about the healthcare system. I'm a teenager. I don't know what it looks like when you see a family doctor. At the time, I didn't know that you really only get 7 to 10 minutes and you get one symptom per consult. I didn't know that. I don't know. So I would say, I'm going to be the doctor. I'm going to see a patient for an hour and I'm going to find out why they're sick. And it's not about prescriptions. And so those are things that I would say, not really having an awareness of how our healthcare system kind of existed. And so it wasn't until that I started sort of gaining a bit more of that knowledge. And then I was introduced to naturopathic medicine. I thought, oh, there's a whole other field of medicine for what I've been talking about. I just didn't know. That's what I need to do. And then I switched.
So you made a pivot. So you're in school. Does that mean
Mhm.
changing schools, changing degrees? What does that look like to make that change from MD to ND?
So in Canada, to become a naturopathic doctor, because I know regulations are different in different provinces and different states. So in Canada, for naturopathic medicine, you have to have a 4-year undergraduate degree in science. So I already had the degree in biomedical science that I was completing. You still have to, complete all your applications and write board exams. So all it did was change, and then I did 4 years post grad for naturopathic medicine. So it was still the same length of time. It just changed the type of medicine that I decided to study. That's all.
So 4 years undergrad science and then 4 years post grad for naturopathic medicine versus traditional medicine, or I'll say Western medicine,
Exactly.
right? Okay.
Exactly. Mhm.
So talk to us about what you're learning in the 4 year post grad education with naturopathic medicine and why you think it's
Mhm.
different than, I'll say, Western medicine and the things we typically get when going to our primary care doctor.
So I would say the first and second year are very similar for naturopathic medicine and sort of conventional medicine. You still learn all the same basic sciences and, the biologies and the biochemistries and all of those things. But then when medical students sort of in their third and fourth year go to the hospital, naturopathic doctors stay in class. So we don't end up sort of in hospital. We don't do rotations in hospital, but we still do physical exams and all of those things. But the focus then becomes really naturopathic medicine is founded in root cause medicine. That's what essentially is the root of functional medicine. Essentially, it's just another word for naturopathic medicine. And so they teach you to do 60-minute consults. Uh, we would still do the same exams that MDs have. So we have to do an OSCE exam, which is a 7-minute, exam where you have to do the intake and diagnose and all of those things in 7 minutes. But really, we are taught to do an intake in an hour. And so the focus in naturopathic medicine is not, it really isn't, short, concise visits. It's let's spend an hour and get absolutely all the information, pull everything together, and then create a really comprehensive protocol from there. Um, as I say that, and as I'm speaking, that also isn't to say that there's not a place for conventional medicine in there, because sometimes there is. And that's also what we're taught, is that understanding when it's time, okay, look, here are the preventive medicine strategies, here are the natural strategies, the diet, the botanicals, etc. But you also need some of the other strategies as well. So it was also learning how to combine the two forms of medicine, which in my opinion is the best kind of care.
Dr. Andy, let me ask you a question. I think it's even different here in the States from state to state, never
Mhm.
mind Canada. I believe if you're a naturopathic doctor in Florida, you can prescribe prescription medication. But if you're one in New York, where
Mhm.
I am, you cannot. What does that look like in
Mhm.
Canada? And if I'm wrong, please correct me because I could be wrong.
No, that's accurate. So, naturopathic doctors have prescribing rights depending where you are. It changes what you can prescribe. So, I'm in Ontario. So, my prescribing rights are different from, for example, a naturopathic doctor in BC, in British Columbia. NDs in BC have full prescribing rights. They can prescribe antibiotics, all of those things. In Ontario, we can't do that. So, I can do bioidentical hormones, I can do desiccated thyroid. So, there's sort of a list of things that we can prescribe, but we can't prescribe everything. So it really just depends on the province. We had to, when those regulations changed, we all had to go back and write a new pharmacology exam and a new board exam to be able to prescribe. So Ontario is hoping that the scope will expand the same way that BC has, because in BC we all write the same pharmacology licensing exam, but they have full prescribing rights over there. Not full; they can't do narcotics and things like that, but we can in Ontario, or
Well,
sorry, and we can't in Ontario. Mhm.
yeah, and I'll tell you, Dr. Andy, both Rich and I and all of Tick Boot Camp, we really believe that what you just described is the best approach, right? A combination of functional
Mhm.
medicine, which really is naturopathic medicine, but also
Mhm.
traditional. I don't want to say traditional because that makes I feel like more Western medicine, right? Because sometimes you
Right.
need prescription. Sometimes you can benefit just on
Absolutely.
homeopathy. Sometimes, but every patient is different. And if you don't have those tools available
Mhm.
to you as a doctor, you're somewhat handcuffed, right? And I think that's kind of, we're going to
Exactly.
get to in a little bit why you're coming full circle
Mhm.
now. And we're going to get there because now you're going to be the
Mhm.
full package, right? Which is so exciting to get to.
That,
But
that's the plan. That's the
yeah,
plan. Mhm.
so tell us how, you're getting
Mhm.
through naturopathic college, your
Mhm.
4 years post grad, and then
Mhm.
what happens next? Are you opening up your own clinic? Walk us through that transition
Mhm.
from your education to your practice.
So I've always been very entrepreneurial. So pretty much from the time I was 19, I was starting little side businesses and things like that. So I always knew I was going to start my own business. That was always the plan. So I graduated. I worked with another clinic for a year, and then it was sort of out on my own, launching my own business. So started a clinic in Toronto, and with a really big focus. And again, because I came from a very athletic background, so I started with a lot of sort of sports medicine, but then slowly transitioned and always incorporating that longevity medicine, and then started adding in, all the hormonal health and things like that. Um, and then slowly, and the transition moved into complex chronic illness. And that transition happened because a patient came to us with Lyme disease. And that was the intro to how I started treating complex chronic illness. And she came to us, she'd had Lyme, she'd been seeing a Lyme doctor in the US. Um, and at the time, I didn't know much about Lyme disease, didn't know much about treatment of Lyme disease, but I was open. She didn't want to keep traveling to the US. She wanted to try to, continue her care in Ontario. And so we just said, well, and my business partner at the time was an MD as well. And so we said, hey, we're happy to help you. We're going to be learning with you because we're not going to pretend that we are Lyme experts because we're not. Um, and she actually coordinated a call with my business partner and Dr. Horowitz because that's who she was seeing. And that was the start of our sort of foray into treating the complex chronic illness. And again, most people in Ontario at the time were crossing the border to get treatment. And once we started to open our door towards that, and people realized they could start getting care in Ontario, we just ended up seeing more and more Lyme patients. And we thought, okay, we need to become we need to educate ourselves here so we can actively help these patients. And then we started traveling and iLabs and all of those things so that we could become the experts that we needed to be in order to help these patients. And that was the start of that journey. And it's just sort of, you know, made its own path from there. And we just sort of never looked back.
So we've heard this often from our Canadian guests and Canadian people we speak to in the community that they've always felt they had to leave Canada because,
Mhm.
I'll say they always say things like, "You guys in America think you have a bad Lyme disease. You have no idea how bad it is in Canada," right? We always hear that,
Mhm.
and we have to come to you. So if you think you guys suck, we suck even worse, and it's all the time we hear that, right?
Mhm.
But it sounds like in the last year or so, we're hearing a slight transition there, where more and more people are being able to find doctors in Canada directly to help them, which to me is a positive
Mhm.
trend. And I think, you're proof positive that, you're now a Lyme literate professional in Canada that can help people. In
Mhm.
fact, somebody that started with Dr. Horowitz, one of the leaders, is now coming to you to treat in Canada, which is nice to see Canada
Mhm.
developing and becoming more advanced in knowledge of Lyme. Not that you're where you should be, nor are we in the States, right? But to see that you're making a move in the right
Mhm.
direction is really encouraging to me to hear.
Exactly. And it was, and patients really needed it. And I think once they found out there was care available, that's where we started to, that's where we started to learn about Lyme and really how, because it's true what you heard from the patients. The care was terrible. There was a doctor who lived in Montreal and she opened a practice across the border. And so she would cross the border every day. So she's Canadian, but would treat her patients in the US and then come back. So it was just tough to get treatment. There was a kind of a lot of red tape at the time. So medical doctors were really kind of handcuffed a little bit. No one believed in chronic Lyme. So it was just this like constant uphill battle. Patients were getting gaslit left, right, and center. Everyone's being told they have anxiety. It was just like it was a really when we started, it was a really um eye-opening, but also really sad to hear everybody's story because everyone had a different version of the same story. which was I've been sick for 5, 10, 15 years and nobody will help me. Now I'm on antidepressant and anxiolytic, but I know I'm not crazy. And I'm like, no, you're not crazy. And I'm so sorry that that's what's happened. So let's like hit reset and we're going to restart. But it was a sad space when we first started.
So, Dr. Andi, I want to bounce an idea off you because we
Hmm.
talk a lot about things on this podcast. And just
Hmm.
yesterday, we had a really nice woman email us through our
Hmm.
contact form on one of our social platforms and tell us,
Hmm.
you guys talk about your definition of Lyme disease all the time in your podcast. And you speak really fast, and I don't really fully understand it, but it's not written anywhere on your website. So I took that personal and I said, you're right.
Yep.
Thank you. And immediately
Hmm.
yesterday, we had a webpage up about our definition of Lyme because we feel it's really important to be able to talk on the same page.
Hmm.
Because, when you talk about chronic Lyme disease, I believe that it's never just chronic Lyme disease equals Borrelia burgdorferi infection, right? It's never just that, in my
Hmm.
opinion. So I want to tell you our definition of Lyme disease and tell me
Hmm.
if you like it and how you think we can improve it. Because and our audience knows we're all about crowdsourcing. So you
Hmm.
might give us something to refine our definition and update our website now that we just put it online yesterday, right?
I love
So
that. All right, let's hear it.
so I'm gonna just kind of at a high level summarize it because
Hmm.
we believe it's really four components, right? When we talk about Lyme disease, it's a polymicrobial disease, meaning it's never just one bug. It could be a bacteria, a
Hmm.
virus, it could be a parasite, it could be all these things, right? And it's
Hmm.
all these things collectively putting a burden on our body. And that includes toxins, it includes heavy metals, it includes mold, right? It includes all those things,
Hmm.
polymicrobial. Then a multi-systemic disease, meaning it's never just aches and pains. It's never just neurological. It's never just cardiological. It's a systemic disease, right? A multi-systemic
Hmm.
disease. And then a chronic disease, because, once you have chronic Lyme disease, it is chronic, right? This is something that doesn't go away and it builds up over time.
Hmm.
And all of these things cause you to become chronically ill. And that's not to say that you can't get better, because I think you and I are both living proof that you can recover and you can go back to a normal life.
True.
And in fact, I never thought that
Hmm.
was possible, frankly, 5 years ago, but it is. And I want to make sure people
Hmm.
know that it is possible. But the final element is, I'll kind of recap, we had the polymicrobial, multisystemic, chronic
Hmm.
disease. But here's the interesting part, where it's an infectious and or post-infectious disease. And this is the final piece Rich and I added based on
Hmm.
interviewing leaders in the space and researchers, because just because you have an active infection, which seems to be implied, right? If it's polymicrobial, you
Hmm.
probably have an infection of Lyme. But in many cases, we've learned from doctors and researchers that the symptomology of chronic Lyme disease might be a post-infectious complex. Not that it's made up, it's real. But if you kill
Hmm.
off Lyme bacteria, or maybe it's dormant, right? Because, again, there's a debate. Can you ever fully kill off Lyme disease? But putting that aside for a
Right.
second, what happens if you kill off Lyme bacteria? There's been a lot of studies showing the remnants or the dead DNA invokes a severe immune
Hmm.
system, creating inflammation and debilitating
Hmm.
symptoms. But that's not from an infection. It's from the residual traces, the DNA of the die-off of the Borrelia specifically. So that's why we chose to add
Hmm.
that, because a lot of research is pointing in that direction as well. And how do we detox? How do we get our bodies to rid that bad DNA causing an inflammatory response, right? So I think that's a component that needs to be
Hmm.
discussed as well. So again, polymicrobial, multisystemic, chronic disease, and then also with the caveat of infectious or post-infectious. What are your thoughts on that?
You know what? I love that. I think that that's great because it does cover, it covers sort of all the aspects of Lyme, and the co-infections, which is why I'll often say complex chronic illness, because I'm never just treating Lyme. You're treating Lyme, Babesia, Bartonella, mold. I mean, you're treating a million other things. It's never just Lyme. So I do love all those. I love all those definitions. Um, I think one of the other things that came to mind when you were talking about that is also it's also a bit of an opportunistic infection. It takes advantage when your system is, you know, not quite where it needs to be. And that's why you have people walking around with Lyme who are perfectly fine and healthy. And so, I've had people come in and their partners have said, I've had tick bites. We live in a rural area. I must have it too. And I'll say to them, do not test yourself, please. Don't, because your immune system is doing what it's supposed to do. And so if we come back with a positive test, what do you want to do with that? Because you're not symptomatic. And since Lyme disease and the co-infection, as you were just saying, is not really eradicated. I always refer to it as it kind of goes dormant.
Yep.
Um, like what, so and I often will measure cure in patients by resolution of symptoms. And that's how I say, cure. back to normal, resolution of symptoms, quality of life. Those are the most important measurements for me. There are other ways that you actually can measure things, but that's how I like to measure it. So I'll tell people, if you do not have symptoms, keep it in the back of your mind, understand the things that can cause those infections to become active. And so actively control the things that you can in your life, but don't test, because your immune system is keeping it at bay. And that's a great thing. And so it's when it's when the opportunity is right, when your immune system is down, the genetics aren't quite there, you have an infection of some kind, you're sick, overload your system, then they take a whole, that opportunity presents itself, and then that's when the symptoms start. So that's kind of the only thing that I would say. I would add to that is that, it sees an opportunity, and that's kind of when it when it comes out.
All right, Dr. Andi, I absolutely love that addition because opportunistic is really important. And we get it all the time, right? From loved ones. I have Lyme, you have Lyme. I have Lyme and my spouse has Lyme. Why am I not sick and they are? And there's so many factors. In fact, I think we don't even have close to we don't understand fully the picture of what goes into allowing Lyme to take over and make us sick, but we know it's a compound effect, right? It could be genetic and it could be epigenetic expressions. It could be trauma. It could be physical and or emotional trauma. It could be you get really sick and you compromise your immune system. It could be a dental procedure that leaks, bacteria and toxins to your bloodstream. There's so many variables that go into this, but in the end, it's always some sort of trigger or some sort of something that allows us to become sick. And that doesn't mean that we're flawed. It doesn't mean that you're the problem. It just means every human body is built differently and our exposure is different. Are you exposed to mold on a regular basis at your job? And if so, it's immune compromising, and therefore the opportunistic component of Lyme disease comes into play if you're chronically exposed to mold and chronically immune suppressed, right? So I want to highlight that. The next thing I want to ask you is, because it all comes together. So we're going to get more into what you do to treat, but all of this is building up in my mind the framework of what goes into chronic Lyme, and then what are we going to do to treat? So we also have our framework that we think is a good model for healing from Lyme disease. So you just touched on that you had a complex chronic illness patient who was treating with Dr. Horowitz, came to you, and you're like, hey, look, we're not Lyme literate at all, but I'm willing to work with you and learn. And that was the beginning of your journey to where you are today, being this Lyme expert, right? You're this Lyme literate doctor now. And I want to get your feedback on our healing framework for Lyme disease that we have, because, and again, we actually have this, we had this on our website in a blog post, so it's up there. We call it the Acre formula. I'm sorry, not the Acre formula, the PARM. I'm confusing this with our tick bite prevention. It's about we have two frameworks. We have one for a tick bite, and then we have another framework for the ability to recover from Lyme disease. So we call it PARM for like Parmesan, right? Because we're Italian and we love Parm. So it's essentially
I love that.
Prehab, which means you have to kind of get your body a little bit stronger before you do an aggressive treatment. And we've learned this from a lot of doctors and patients saying, I jumped into treatment, it was too aggressive, and I got even worse because their body was so compromised and weak, right? So that's like one little bucket of get your body strong enough to treat. It might be detoxing, it might be your lymph, it might be, your emotional health, it might be your MCAS, right? It might be a whole bunch of things to get your body strong enough to be able to tolerate the treatment without having an extreme flare. The next piece, the A, is the assist. And we say assist because you're assisting your immune system in eradicating the polymicrobial component of Lyme disease, all the bugs, not just Borrelia, right? So whether it's antibiotics, whether it's homeopathy, whether it's methylene blue, right? Whatever it is, whatever your doctor partners with you on, you're assisting your immune system in eradicating as many bugs as possible. But that can be flaring, and that's why the prehab component is necessary. Then after that, we have the recovery phase, which is rebuilding your body, because Lyme will really do damage to your body. So you have to work to repair and recover and rehabilitate your body. And that could involve just, daily lifestyle changes, right? Making sure you get enough sleep, making sure you're getting enough, movement in, maybe some cardio, maybe some weightlifting, strength building. It could be therapy. It could be emotional, right? It's all the rehab from all of the physical, emotional trauma on your body from Lyme disease. And then the M is for maintain, where, okay, you're in a good place, I think, where we are, right, Dr. Andi, you and I right now. And you have to maintain that because, you can have some setbacks that cause you to potentially have some symptomology return. But if you maintain that level of health, again, sleep, diet, maybe some herbs, maybe some whatever's in your toolbox, and you have that maintenance sort of phase, you're going to significantly decrease the likelihood of a flare or a relapse, as a lot of people call it. So I'd like you to respond to our PARM framework for healing Lyme disease too.
You know what? I love that. And it's funny because I also divide my treatment into 4 phases, very similar to that. So so I call them phases. So we do phase 1, phase 2, phase 3, and then phase 4 is the maintenance. Um, so pretty much very similar to that. And the phases are quite similar as well. So I love that framework because that's sort of the same kind of framework I've embraced as well in treatment.
Well, having somebody as smart as you validate that has made my night. So thank you.
No, it's that's awesome. No problem.
So can you now tell us about, because now I want to kind of bring it all
Mhm.
back together with your personal journey. So you're now
Mhm.
seeing this complex chronic illness patient, you're learning about Lyme. Tell us how you're learning about Lyme and you're overcoming some of the misinformation because there's
Mhm.
so much misinformation out there across the board.
Mhm.
So how are you sifting through the sea of nonsense to learn the factual side of Lyme disease? Who are you mentoring with? Who are you partnering with? And how are you learning and
Mhm.
growing? And how is that forming your treatment framework? And that's kind of where I want you to get into like what your 4 pillars look like and tell us
Mhm.
specifically what you do in each, right? Treatment modalities, herbs, pharmaceuticals, all of the above,
So I would say the first people that I give credit to are the patients because it's the patients. Lyme patients are so well informed, um, and they're in Ontario. We're very frequently ignored, and so I would say that my first step was to open my mind and ears essentially to patients and just start listening. And they're the ones who brought the information initially, and they'd say, hey, I read this article. Hey, what about this? What do you think about that? And the patients are emailing and bringing things and so that was the start. And so I really do credit my patients first. Again, they're so well educated and they were patient with us as well, knowing that I wasn't a Lyme expert at the time, but I was like, I'm going to help you. I have this foundation knowledge and I'm going to learn. I'm going to help you. And so it was really this relationship where we worked together initially, and they were bringing all this information to us. They were, getting treatment in the States and starting to transition their treatment into Ontario. So initially it started with this sort of massive research deep dive. And so I just spent hours researching and reading and, reading all the books. And I would say Richard Horowitz is probably one of my favorite resources. So reading his books and that was the start. Um, and then it was, ILADS training, and that became, an annual thing and more when possible. And then we started doing private training with Dr. Horowitz. Um, the seminars with Dr. Neil Nathan, and we slowly started to incorporate, all the information with the, mold and mold toxicity. And then we started to incorporate environmental toxins and started going to a lot of the environmental. So it slowly became this thing where annually I was attending 5, 6, 7 conferences, just kind of all around the world, just expanding my knowledge, listening to experts. And I'd say, okay, well, that's something we hadn't incorporated already. Okay, let's give that a try. We're going to incorporate that. And it just became this vested interest where it was literally that I was just researching nonstop, flying all over the world whenever I could to learn, reading. And that was really how I created that knowledge. But the foundation, I still give credit to my patients.
So, Dr. Andy, let me ask you a question because it became very clear to me after getting to know the iLads members better that, some people generally go, oh, iLads, they're very antibiotic driven and I'm not. So I don't like iLads. Or,
Mhm.
oh, iLads, they're hippies. So I don't like that. I'm not doing it. I go, they
Mhm.
can't be both, right?
They
But
can't be
then when you
both.
look at, but when you look at the spectrum of doctors on iLads, there's truly a diverse set of doctors that use a wide
Mhm.
variety of modalities. I mean, Horowitz is very heavy
Mhm.
antibiotics. Dr. Cameron is another great guy that we've had on the podcast, another big antibiotic user. But then you have
Mhm.
other doctors like Dr. Jill Carnahan, who's very much natural minded, right? So it's
Mhm.
interesting that you have, and then you have, Dr. Greenfield, who's another one who is kind of a mix, and somebody like yourself
Mhm.
who's sort of in the middle, right? You're kind of right in the middle, which I think is the perfect place to be.
Right.
Not too far to the right, not too far to the left, as far as antibiotics
Mhm.
versus natural. But how did you parse through during your ILATS training where you wanted to land because you had, Horowitz and probably influencing you one way to be, strong antibiotic, and you had other doctors probably leaning you to be more hippy dippy, right, with herbs and
Mhm.
and like that kind of stuff. So how did you parse through that? Because I feel like that must be a struggle for some doctors trying to learn from ILADs.
Mhm. So I think the way you sort of get through all that is one, trial and error for sure. But then also when you start to understand the foundation of Lyme, and so you will hear people who will come in and say, "Oh my goodness, I saw this doctor and they threw 5 antibiotics at me and it almost killed me and da, da, da. I'm like, no, 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 like you can't do that. And so the knowledge and feedback from patients is actually what structured how we treated Lyme and co-infections. So really all those complex illnesses. And so really the phase 1 was foundation. And so we wouldn't even introduce antibiotics until about 6 months. So people would come knock down the door. I want antibiotics. I want antibiotics. And we're like, no, because not everyone needs them. And so phase 1 is foundation, addressing all of those things, like why somebody is sick in the first place, genetic issues, inflammation, poor immune function, gut disruption, underlying viral infections, all of those. That's phase 1, getting your body ready. And then while waiting for phase 2, we're waiting for all your testing to come back. Because most often people, they might have done Lyme testing, but there are a million other things they haven't done. I test every Lyme patient now for mold, because if you have mold and Lyme, you've got to treat the mold first because it's an immunosuppressant. So, and I would say to patients, I could treat you for Lyme, but 6 months from now, you might not be well. And we find out we've lost 6 months of treatment because we missed the mold. So just do them both. And if you don't have mold, amazing. But like 90% of them did. And so phase 2 would go into only natural treatment of infections like the mold and the chronic infections and things like that. And so that in and of itself is almost a 4-month period of time. And then you sort of add on a little bit of follow-up. So it wasn't until the 6-month mark where we would even determine if antibiotics were a good option for these people. I mean, I've had a patient who couldn't even take vitamin D. She was so sensitive. We were literally doing vitamin D drops, and it took her a year to be able to tolerate a vitamin D drop. And that didn't cause, a Herx reaction or something like that. She was just so sensitive. And in a patient like that, you cannot give them 5 antibiotics. Like you can't. I mean, and it's just not even an option. And so it's the slow, phased, gradual introduction. Same thing with the botanicals. And I have a really special way I have them introduce botanicals for sensitive people. We start with like drop dosing. More is not necessarily better. So if you can only tolerate a 1/4 teaspoon, that's your dose. But if you can only, handle a 1/4 teaspoon of a botanical, there's absolutely no way you can handle 5 antibiotics. So antibiotics are not even an option for you yet. So there's a way that we created this process that allowed us to prepare the body, increase tolerance, and then introduce antibiotics when needed. And in some patients, by the time you got to that point, they were better and didn't need them. And that's amazing. And if they didn't need it, great. And for some people, we'd say, okay, you know what? Let's add the antibiotics in. We've got to like kick this up a little bit. And then we'd add the antibiotics in. So it's a long process, but again, more is not always better. The intention, and some people will get Herx reactions and they're like, I'm just going to push through. No, don't push through. We're harming you. The goal is not for you to be bedridden because of a Herx reaction. That's not helpful. And so that's sort of how those pillars became structured. And that's how I decided what kind of treatment was introduced when. So it wasn't just like a free for all and we throw everything in. It was, do you even need this? Is this beneficial for you? Can you even tolerate it? What's going to happen if we put this in your system? And so we created this system that allowed an improved or increased tolerance to treatment as we went. And sort of that's kind of how we created it. So some patients get antibiotics, some patients don't. It's always on the table if we feel that they need it, but it's never where we start.
So is your third phase the antibiotic treatment? Is that what that third phase is you mentioned?
Yes, usually third phase is antibiotics, and then 4th is our sort of maintenance phase.
Got it.
And if there are parasites in there, we do parasites and all that stuff as well. But
so where do you
that's usually phase 2.
Parasites is phase 2 because you're killing the parasites, right? It's more on the
Exactly.
natural botanicals or whatever to kill the parasites, right?
Exactly.
Got it. So can you talk to me, Dr. Andi, about each? I just want to go in a little bit deeper to each of the 4 steps. So foundation is get your body ready. Can you give me a very specific thing that you see during this phase and how you address it? Meaning what's common during this first step? And then what are you doing from a naturopathic side to address that thing?
So do you mean in terms of the patient's symptoms?
Yeah, not only symptoms, but like, what would it be? You said, I think you mentioned like inflammation, you mentioned genetics, you mentioned MCAS, right? Things to kind of get your body ready and strengthen the body. So how are you identifying what those things are? Genetics, inflammation, et cetera. And then what are you doing from a treatment standpoint or is that next? Is that on the natural side? Because is the foundation just like is foundation just
Hmm.
identifying what's wrong to then address on the natural treatment phase, or is foundation addressing the inflammation before treating the infections in phase two? Does that make sense?
So it does. So phase one is when people come in with their sort of their complex chronic illness, and we were talking about that before, like why are some people sick and some aren't? We're addressing the factors that we know could be contributing. So, if your immune system's not functioning, or if you're, genetics, you might do some genetic testing. Optimizing detoxification. Most people who are symptomatic of Lyme and who have mold toxicity have terrible detoxification genes. Um, the term detox is very controversial because when you say detox, people think you're talking about, crazy, flushes and the tea, but that's not what we mean when we say detox. And you have this whole other camp that is like, our bodies know how to detoxify. You don't have to do anything to support the genes to support detoxification. And I always say that that's not true. Sometimes our bodies need help, but we're supposed to be able to sleep, but some people have insomnia. We're supposed to go to the washroom twice a day, but some people suffer from constipation. Just because we're supposed to be able to do it doesn't mean our bodies can. And so sometimes we need help. So I'm addressing all of those things. So I'll always address those foundation pillars that predispose people to becoming symptomatic. So inflammation, poor immune function, genetics, and poor detoxification. So usually that's being addressed. And then we've also usually done blood work. And so I always say to patients, we want to address all of the abnormalities we find in your blood work because we can't attribute everything to Lyme. I'm sure a lot of your symptoms are due to Lyme, but we also don't want to miss anything just because we think everything is because of Lyme, because it's not always Lyme. So if your hormones are off and your thyroid is off and all these other markers are off, we need to fix those. And then we need to find out which symptoms are actually attributed to infection. So let's address all the things we can address. Let's fix address the foundation, the reason you're symptomatic in the first place. And then I'll often do some symptom management. So depending on what people come in with, usually people have some key debilitating symptoms, and it's not the same for everyone. For some people, it's insomnia. For other people, it's chronic pain. So a lot of people with Lyme have chronic pain, but for everyone, it's always a little bit different. So I will do some symptom treatment in that phase as well, just to kind of ease, just to help them feel a little bit better as we go. But most people are starting to see improvement in that phase anyway, just with that foundation. And then I'm also making dietary changes. And usually when people come in, they'll say, I've done all the diets, I've done all the things, and it doesn't work, and I'm still symptomatic. And then I'll always say, we have to put into perspective what we're doing with the diet. Like what is the expectation of your diet change? Because if the expectation is you change your diet and all your symptoms are gone, that's not the outcome we're looking for, because you have underlying bacterial, fungal, viral infections. And so going, gluten-free isn't going to treat a bacterial infection. So you have to change your perspective with respect to what the diet is doing. And so the diet is setting the stage for healing. And so I always say, there's so much we can't control with these infections. And so what we need to do in phase one is control the things we can. And we can control what we put in our mouth. We can control what we put in our body. And that sets the stage for healing. There are foods we know that we're inflamed when you have, this massive cytokine storm, when you have Lyme disease. So why put things in our body that are going to contribute to inflammation? So the diet sets the stage for healing. The expectation is not that all of your symptoms will go away. Although that said, for me, so I've been keto for a very long time, intermittent fasting. And when I was quite unwell, one of the things I noticed is that when I deviated, so I was able to work when I had, Lyme, and I never had to stop working. I wasn't bedridden, but when I deviated from my diet, I was bedridden. And I remember going on vacation, I was eating a croissant for breakfast and whatever, just enjoying. And I would have to go straight to bed. And I was in bed all day until 5 p.m. And I did that for 3 days. And I thought, okay, why am I doing this? I know that I don't have to eat like this. And when I didn't eat like that, I was fine. And so I remind people, like, you don't have to eat like this forever. I promise. It's not like this forever, but it's like this for right now because we're still in the treatment phase. We're still treating. We still need to help you be well. So we just have to change the perspective surrounding what we're wanting the diet to do. So no, diet's not going to get rid of all your symptoms. We have to make those diet changes in order for us to, get you to where we want to be. So diet changes are also a really big thing that we're doing in that phase as well.
So I know a lot of listeners are going to give me feedback if I don't ask you some of these follow-up questions to that,
Mhm.
because this is gold, right? This is all great information. I'm going to go one layer deeper to this, though, which is
Sure.
if you identified a ton of things, and I'll pick on two of them,
Mhm.
right? If somebody's having hormone issues that you want to address at the
Mhm.
foundation phase, what are the things you do to help address hormones? So, for example, bioidentical hormones you mentioned earlier, right? Is that something you do?
Mhm.
You mentioned mold exposure, right? As something that
Mhm.
you've studied and learned from ILADS doctors, and you find that at the foundation phase, because if you don't address mold, you're never going to really be able to fully recover from Lyme, right? Which is the step two of
Mhm.
the natural treatment of the infections. So for
Mhm.
mold, are you giving people binders to detox the mold? So specifically, if you can identify a subset of the things you just said, right, like mold and hormones and immune system and genetics,
Mhm.
and then what are you doing to address those things with your patients and having them do and or take to make those foundational improvements
Mhm.
before treating naturally the infections?
The infections. So first, to answer your hormone question, yes, absolutely bioidentical hormones. I love bioidentical hormones. I'm a big fan of hormone replacement. I've done hormone replacement for a long time, probably since, right after I started practicing or I began practicing. So hormones, absolutely. It does make a very significant difference. I find that women with Lyme or mold, they have a lot of cycle issues, cycle irregularities,
Yes.
PMS, and for them, progesterone is it can be magic for some patients. It just makes such a big difference, and so again, if we're able to treat some of those symptoms, and I'm okay with symptom treatment, like the goal is to get to the root cause, but we also want you to be functional and engage in your day-to-day life and, start doing some of the things you did before. And so symptom treatment is okay too, while we address the root cause. So let's get you on hormones or, for the detox phase, I'm not generally treating mold in that phase. Um, it's too much to do all that at once. Anyone who's treated Lyme, you're on a million things. People know that. You just swallow so many pills, and so it's too much to start. And so I also put that again back more into kind of the treatment phase. So we'll start first with genetic pathways, tons of, glutathione and, liposomal
Yes.
glutathione and things like that. Um, sometimes we might, for other kind of some of the other symptoms like chronic pain, we'll still do some prescriptions. We might do some LDN, a low dose naltrexone. We might, we're doing a lot of things to manage that cytokine storm. We're doing lots of things to manage the immune system. So I really like colostrum as, foundation immune. It really depends on the patient, to be honest. Sometimes if I know Epstein-Barr is underlying, I'm doing a lot of, echinacea. Um, if there's autoimmune, I'm doing some Rehmannia in those phases. And so for those, I will do some botanicals in the first phase, but not antimicrobials. So I will treat some of those other underlying factors, but I'm not going to do antimicrobials. If I know somebody has a lot of gut disruption, we will do some gut healing in that phase as well. I'll usually do the spore-based probiotics just in case SIBO is underlying, which in most patients it usually is. So we're not trying to make that worse. I'm going to do a spore-based probiotic instead of a typical kind of acidophilus. So for me, I don't have, and I'll say that to patients, there's no cookie cutter protocol. I don't have a sheet that I'm going to print out to you for you and give to you because and I've treated thousands of Lyme patients at this point. Every protocol looks different. It just depends on who the patient is who comes through the door.
Your answer was exactly what I was looking for, because and right, it is not a cookie cutter approach. It's not just going to do 1 through 7 and you're going to get through phase one of foundation. But some people
Mhm.
that are well versed enough and maybe have been through it in their season, but they think they're missing something, you just gave a ton of
Mhm.
information that can help them maybe identify one thing to try to get over a hurdle that they're
Mhm.
stuck with potentially, right? And that's what I'm really looking for here
Right.
for our listeners to learn. And then, of course, if they need help, to come and treat with you, because I know you do virtual
Mhm.
treatments as well, and virtual consultations to your practice, which we're going to get to even in more detail as we get to the end of this. But so that's the foundation piece. The natural
Mhm.
treatment side sounds like is when you're addressing the infections. You mentioned the mold as well, and are parasite treatments done in this phase as well?
Parasites will be done in that phase as well. And so I'll usually actually do mold and parasites before Lyme. So kind of when people are, if they come back positive, so in the first visit, they're usually at 2 months between visits. I like 2 to 3 months. So it kind of 8 to 12 weeks because I want to see how they're responding to that first phase anyway, before we add a whole other phase. Because it's not like when you add in phase two, we get rid of phase one. You keep phase one and add in phase two. So now we're, so so I like to do them kind of graduate in a gradual way and kind of stage them a little bit. So if there are parasites, if there's SIBO, if we have mold, I will treat some. I usually will do that next. And with SIBO, I usually do a short treatment, a short 6-week botanical treatment of SIBO, or we'll do, rifaximin and neomycin and just kind of do that quick 2-week treatment. And then I'll often come back to that at the end because they're on so many antimicrobials when we're treating infection. So again, depending on the patient, but I will do some SIBO treatment, definitely starting the mold. We will do some parasite treatment there as well if all of those things are present. And then we start the botanicals. So then we'll do botanicals for Lyme, Bartonella, Babesia, etc. So then we'll introduce some botanicals. So all of that I just said can take 6 months. So 6 months before we even get to our antibiotics an option for you. And sometimes they are at 6 months, and sometimes at 6 months, patients haven't even been able to introduce all the supplements from phase two. And if you can't even take all the supplements in phase two, you're not ready for antibiotics yet. So we just, slow and steady, we keep going. So the length of the phases are also determined by the patient.
So Dr. Andi, I think you know where I'm going next, because this is just like phase one, foundation, and my follow-up question there, which is going to be, please give us specifics if you're comfortable as far as things you would consider doing in each area, right? So specifically, you mentioned parasites, mold, and SIBO, and you gave us a lot of detail on the SIBO side, but you just said botanicals and didn't give us what type of botanicals, right? But then when it comes to mold and parasites as well, what are some common botanicals and natural things you're doing to address parasites and mold? Because there's so much out there and people are you get very confused. So if you could just give us your experience and recommendations in those areas from a botanical standpoint.
So the first I'll also do not a botanical, I'll do a lot of biofilm work as well in this phase, usually if we're doing mold and SIBO and parasites. So we'll do some biofilm work in that phase as well. And then for the botanicals, again, it's also always different. So SIBO is a pretty comprehensive protocol when I give it to patients. And so it's a blend of, we're doing a lot of oregano oils, we're doing, and then, so I try to also pick botanicals that overlap a little bit. So, we're doing like podarcos and wormwoods and things like that. So I try to overlap a little bit. So the interesting thing is that in phase two, when I do that, you're naturally starting to get some antimicrobials that will kind of start to trickle into phase three. And so when I do that, and again, depending on how sensitive a patient is, if they're, I've had patients who have to do their consults from bed in the dark. For those patients, I wouldn't give them botanicals. I don't give them overlapping botanicals at that point, like the antimicrobials. I will probably wait. So it's a bit of a slower approach. I might just do a bit more of the mold first, because then we're using binders like charcoals and things like that. So we're doing more binders, which, you can still have sort of detox reactions and Hertz reactions, but I'm more comfortable doing that and working our way through that, and then introducing some of our botanicals. And then when we get into the Lyme phase, it's, again, depending on what we're addressing, but it's a lot of, sometimes I do combinations of like Sida, Cuta, and Cryptolepis, and I try and overlap with Lyme, Babesia, and Bartonella and kind of get all of those in. So again, it just depends. It depends on the co-infections they've come back with, depends on what is positive, depends on how they tolerate it. So everyone's looks a little bit different. There are some kind of key things that I love, but everyone's looks just a little different.
No, that completely understood. And I think that was a brilliant answer. And I'm glad you touched on the fact that some of the botanicals used for the first part on the natural treatment side, which is the parasites, the mold, the SIBO, et cetera, might have, I'll say, cross purpose, right? Where they're actually antimicrobial, killing the microbes, like the Lyme microbes, the Bartonella microbes, right? Those as well. So somebody
Hmm.
super sensitive, you're going to be cautious to do that because it might cause a flare. So you're focusing more on maybe the mold
Hmm.
and detox and the things that aren't going to be cross-reactive to the Lyme and the other things
Hmm.
like the parasites, the mold, and the SIBO. And then
Exactly.
when it comes to the infections, I feel like the cryptolepis is a really common herb we hear used often.
Hmm.
You use things like Japanese knotweed and a lot of
Absolutely.
the cat's
Hmm.
claw, a lot of those common
Cat's
ones we hear.
claw, and exactly. Hmm.
Now, are you using tinctures or are you using like herbal capsules in, more herbs ground up in a capsule like you would see from like a Dr. Rolls or, somebody like him?
Hmm. I prefer tinctures. And I warn my patients and I apologize in advance. I know they're disgusting, but um, I just find the results with the tincture. So a few things. I really like the results from a tincture. Um, and then it also allows for a much easier process when we're kind of staging how you treat it. So if you're really sensitive, I might have someone say, I want you to do a drop on your tongue of this botanical and tell me how you respond. If you're good, then tomorrow you can do 2 drops. And so it allows those really sensitive people to really control the dose. Then when we get to the tolerable dose, we introduce another botanical, and then I tell them we can start pouring them all together and drink it. But my preference is always liquid, the tinctures. I do find those more effective. The alcohol tinctures over the glycerin tinctures. But again, when you move on to the antibiotic side, sometimes you have to do a glycerin tincture, and some people just can't handle the alcohol in a tincture. So that's also fine. We make modifications as needed. So I always have a preference, but obviously will always change if it's not something that a patient can tolerate. But I love the tinctures and the liquids.
Now, the tinctures, are you making them or are you recommending a brand? What specifically are you doing in that regard? Because some people actually make their own tinctures
Mhm.
as NDs and other people actually use
Mhm.
common tincture brands that exist for their patients.
I'll use common tincture brands. We don't make them. I don't know if you want like names of companies that we
Yes, no, no,
use,
yeah.
or
There's
you
no,
do?
yeah,
Okay.
yeah. I have no problem. Like I love Dr. Rolls, and that's why I said it. Like his Vital Plan, I take the capsules. They just happen to work for me, right?
Okay.
But yeah, there's no holding back on this podcast. You can say all the
Okay.
names,
So
everything.
I can
It's
say the
totally
brands.
cool.
Okay.
Yep.
Okay. So that puts it back in phase one. I do love a lot of the research nutritionals products, like Cytoquel and things like that. So that's very well known in the Lyme community and iLads. For the botanicals in Canada, I will often use a company called Veriditas. I also really like MediHerb. MediHerbs they're based in Australia. They have really good botanicals, and the founder of that company was a former pharmacist who got out of the typical medical field and went into botanicals. And he has really good kind of powerful botanicals. I love the MediHerb botanicals. I love the echinacea. As soon as it touches your tongue, you can feel the tingling. Like you can just tell it's good quality echinacea. I love the echinacea by MediHerbs. I love the gold. I use a ton of golden seal. I would say if I were to list some real, like my favorite immune botanicals, I literally carry them in my purse on the plane. My 4 favorites, just in general, are golden seal, echinacea, licorice, and andrographis. Those are my 4, and I keep them in my purse. And if I get on a plane, I take them. If I feel a scratchy throat, I'm like drinking golden seal. Like those are my my all-time favorite botanicals. And so I love some of those with MediHerbs. I'll use a lot of Nutrimetics because they have a lot of the Lyme tinctures in single vials. And then I'll also again use companies in Canada that allow me to kind of compound as well. So I'll make custom formulations, and then I send it to an herbal like someone who makes the formulation, and then we send it. So I will make custom formulas, but my preference um, is actually single botanicals. I over a combination because I want full potency of every single botanical. And so the more you put into a bottle, the less you get of each specific botanical. So if you have 5, 7, 10 botanicals in a bottle, you're getting smaller amounts of each individual botanical, and I want full dose of every botanical. And so I'll say again, I'm really sorry you're gonna have like 10 bottles on your counter, but just do a little dropper into a glass from all 10 bottles and drink it all together. But I want full dose of all of them. And so I like individual botanicals.
So walk us through the step 3 here, which
Mhm.
is your antibiotic treatment, which might be optional because
Mhm.
sometimes people don't need that, right?
Mhm.
As you noted. But what kind of antibiotics
Exactly.
are you using from a pharmaceutical standpoint? I mean, obviously, doxycycline is the
Hmm.
most common when somebody gets bit by a tick for what we'll call acute Lyme.
Hmm.
You know, we've heard a lot of other like minocycline, which I'm saying wrong, can penetrate the blood-brain
Hmm.
barrier better. Right? So there's a lot of ones out there we've heard of a lot. What are
Hmm.
antibiotics you use and you think work best when it comes to that third step?
So again, it depends. Usually, so we're never just giving one or two. It's usually three, four, five antibiotics all at once, which I'm sure people are familiar with. And then it depends on each individual. Um, I use, like myself personally, I used doxycycline because we will still use doxycycline in chronic Lyme, but higher dose and more long term. Amoxiclav in our clinic, we also eventually introduced, disulfiram and Dapsone, the high dose Dapsone protocol. The high dose Dapsone protocol is kind of the newer protocol, and I'm on the fence if we're seeing greater benefit from the high dose Dapsone protocol than just sort of so that one I'm on the fence with, and you have to be careful and make sure that you're taking, the methylene blues and things like that. So that one I'm not,
Well,
I
this is
don't
this is
know if that
sorry, Dr. Andy. This is like the double Dapsone, quadruple Dapsone, right? We've heard this
right.
like, oh, I'm on Dapsone was a thing, then it was double Dapsone, now it's
Mhm.
quadruple Dapsone, and it's like, well,
Exactly.
what is the difference between all this? Can you tell us like,
They're
is it
just
literally
it's
just a
just
higher dose?
higher dose. It's just
Okay.
higher dosing, but then it increases the risks of side effects. And so based on what Dapsone does, it can cause your oxygen saturation levels to drop. So then you're given the methylene blue to try and prevent that. But we had one patient who, they are given very strict instructions. You must take the methylene blue. You have to start taking that before you take this. And so we had one patient who just decided he didn't want to. He just decided not to, and so he ended up in a merge. Because that so little things like that, it's important to make sure they follow the full protocol. So from an antibiotic standpoint, it's different. I personally didn't do disulfiram or dapsone. My sort of Lyme journey was back in 2016, 2017, sort of before the disulfiram research was kind of just coming out at that time. And we were just starting to use that in practice, but that's not something I introduced. And actually, dapsone I did have at the lower dose, but I only used that for about 2 months before I kind of stopped my antibiotic protocol. So for everyone, it's different. A lot of Malarone for Babesia. Um, so it just depends on what we're treating.
I love that. That was a super detailed answer. I do want to ask you because we subscribe to anything and everything Lyme related to alerts right through the news, and
Mm-hmm.
I got something this week about disulfiram, and it was fascinating.
Hmm.
So it was a really deep, and you probably would have understood it without having to cheat, but I had to take this research study and plug it into AI and tell me what does it mean because I'm
Hmm.
not as smart as you, and it basically told me that disulfiram has, and it was a study with a small set of people and
Hmm.
25% of the participants that did disulfiram for chronic Lyme had such
Hmm.
adverse effects they had to stop like within a few days, right? And
Hmm.
then in the longer term study, I believe it was like 60% had such adverse effects they had to stop. And the conclusion section of this research study was A, we need a larger study, a larger sample, right?
Hmm.
B, what we can deduce from this smaller study is that disulfiram has such severe adverse effects that it may not be a go-to model because of the side effects of disulfiram. Now, is that
Hmm.
consistent with what your experience is, or do you think that that's not your experience based on your practice of it?
Clinically, we don't see that. Of all of them, I wouldn't say that that would be, I mean, people for sure, because we're dealing with a very sensitive population. So 100% people will, can have a side effect or a reaction to something they take. But I would not say that that's the case with the disulfiram. And obviously, you kind of start low. I would also, in that study, and were they making sure they were avoiding all, different alcohols, but then also,
True.
did they take a Lyme population who hadn't done any of the foundation work and then throw disulfiram at them and see how they responded? Because if they did, then I'm not surprised that they would have had a negative side effect because we would never just take someone and be like, here's disulfiram, let's see what happens. Because
Yes.
again, most people where antibiotics are thrown at them, they don't actually do super well when they're really sick. So I would have some questions about that study.
Well, Dr. Andy, I think as soon as you said that, the dots, everything connected in my brain. I'm like, yep, that study probably didn't make sure they had the foundation and the natural treatment
Mhm.
side of it before the antibiotic treatment, which is your phase three. So in your
Mhm.
practice, you don't have that response because they're already strong enough in phase three to
Mhm.
handle disulfiram, but probably not in the study, which is why it wasn't
Right.
received in the same way your patients receive it. That makes
Mhm.
complete sense. And again, I think
Right.
this goes to the validity of a phased approach, right? We call it acre, and yours is
Mhm.
similar but a little bit different. But I think it's so important to go through these steps. Otherwise, you may go into disulfiram without having the foundation and the natural side of it, and you're going to get even worse than you
Right.
were, right? Instead of
Then you
getting
were.
better because you
Mhm.
built your foundation. And I think that's such an important note to this entire conversation. It keeps coming back to that, which I
Mhm.
love. Yes.
Mhm. And we've had patients who've come in, um, and they're just begging for antibiotics because they've done some treatment before, and maybe not necessarily in the way that it's sort of structured or that we've structured it, but they've had it, they've done it before, they're begging, begging. And so I think there are maybe 3 or 4 instances where we've caved and said, okay. And in every single one, it was very bad. Every
Yeah.
single one of them. We let the patient talk us into it, and we would tell them this is not going to go well. Again, we've had over thousands, like thousands of Lyme patients we've treated. We never do it this way. And they're like, please, 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 please. And 4 instances we've caved, and every single one of them, it's gone sideways. And we're like, well, now we have to kind of get you to heal from this first, which can take some time. And then let's go back to step one and try that again. And we knew that was going to happen, but you know, some patients have just been so unwell for so long. It just, every now and then you change how you how you do it, and they've been on botanicals and things like that. And you're like, okay, fine, let's see. I would say all of those instances.
Hmm.
The only time that works is if people are acute, if it's acute Lyme,
Yep.
if they just got a bite or it's very, very new onset of symptoms, like within 6 months or a year. For those patients, that approach could work. And though and our chronically ill patients, 5, 10, 15 years, absolutely not. Like you can't. You just can't.
Yep.
And every time we've tried, we reinforce that theory. Just we can't.
So, Dr. Andy, what are your thoughts on, and it's just very timely because I've been following,
Mhm.
and again, putting politics aside, but RFK and his approach towards health,
Mhm.
and he's out there talking about stem cells, nutraceuticals,
Mhm.
hydroxychloroquine, ivermectin, all things we hear about in the chronic Lyme community, and how, and I'm not going to lie,
Mhm.
I went back and listened to his podcast with Joe Rogan. Again, politics aside, I wanted to hear what this man had to say because he's now heading up,
Mhm.
the medical side of our federal government, right here in the U.S.
Mhm.
So he's talking about the political side of it, or I'd say the lobbyist side of it, where hydroxychloroquine costs maybe 5 cents a capsule versus $3,000 a pill for
Mhm.
something else, which is why it's not
Right.
recommended or utilized for things like chronic Lyme to help maybe modulate the immune system. And not that it's going to
Mhm.
cure Lyme, I'm not suggesting that, but if it modulates the immune system and decreases inflammation, we're setting a better foundation, in your words, for maybe a
Mhm.
natural antimicrobial, right? So, what are your thoughts on that? I mean, what
Mhm.
are your thoughts on hydroxychloroquine, ivermectin, and a lot of these things that we hear in the community, but there's such controversy over when it comes to Western medicine,
Mhm.
whether or not they're actually effective tools in chronic Lyme?
So we use those in our clinic. The past few years, it's been a very controversial topic with the big C and all of those
Yes.
things. So it was an interesting time. And I would go to a dinner party, and all of a sudden people are like, hydroxychloroquine is killing people, ivermectin will kill you. I'm like, okay, hey, let's
Nope.
just be clear on what we're saying here. If you don't think it's an effective treatment for the big C, that is totally fine. But those drugs are not killing anyone. They have been used for years. So let's just be very clear on what we're all saying. So, like, these are two different things that we're saying. These are very effective drugs with very few side effects. So let's not demonize the drug. And so with RFK, it's very controversial. So I would say there are pros and cons to what he is doing. Um, I understand the concerns everyone has where we have somebody in this position with zero health background. And so that's a little bit scary. Um, but he is also very well educated. One of the things I say about my patients and the Lyme community is they're very well educated and very knowledgeable. It's not like people can't learn these things. I mean, this information isn't restricted to doctors. It's not like doctors are the only people who can learn it. So in that sense, I do think people can be very well educated and they can be very well informed. I do think when you don't have that science background, is what you're missing is clinical experience, ability to effectively interpret a study. What does it mean? How do you interpret data? And I think that that's a problem because I don't think that that's a skill that many people just have when they read a study. So that can be a bit of a concern. On the other hand, I do like to hear that it's one of those things where he wants to make those drugs more accessible. Let's stop demonizing them because they shouldn't be demonized. They should be very accessible. They're cheap, which is great. And so I'm sorry that that doesn't make certain organizations a lot of money, but it is so effective for the people who need it. And so from that standpoint, that's amazing. Again, it makes me nervous. He doesn't have a health background or any of those things, but I do think healthcare needs a bit of a reform. So I'm not going to say if he is or isn't the man to do that. But I will say that healthcare needs a change. It needs a focus on preventative medicine. The guidelines with respect to health that come from the government level are outdated and not great,
Yeah.
for lack of a better word. And so
You can be honest, Dr. Andy. You don't have to beat around the bush because it's
I'm
okay. We're
trying
all
to be
entitled to
so
our opinions.
diplomatic right now.
This is a no judgment zone, right? So you can feel free to speak your mind if you're comfortable.
Yeah. So, he put up, so I'm a big advocate, longevity medicine is kind of my thing as well. I'm a big fasting, keto, biohacking, all those things. I'm into cold plunging and all of that stuff.
Yeah.
And I think he put up a post the other day that said, if you cut out the carbs, started fasting, did some cold plunging, went and, stood out in the sun and put your feet in a forest, we'd cure whatever percentage of chronic disease. And I mean, the backlash she got from that post was a little surprising, but I was like, well, there's nothing inaccurate about what he just wrote. If the entire population just did those things, that's it. No, like, food counting, calorie counting, macro, just do those things. Go get some sun, go walk in a forest, cut out your carbs, do some fasting, cold plunge. Like, the health benefits you would experience would be astronomical. And so it's interesting. I think he's getting backlash because some people are concerned about the lack of scientific background, which I get, but I love when I see stuff like that because that is the message that needs to come from the top down. We need to, cut out the carbs, cut out the sugar, cut out the added, all of those things. We have a chronic illness problem. We have an obesity problem. And what we're doing isn't working, so something's got to change. And so I agree that change needs to happen. And because I'm a big fan of all of the things that you just listed, I'm like, well, that I support. So that's good. So
Yes.
I'm on the fence, right? So I'm on the fence
Well,
with
yes.
his outcome, but I'm hopeful that positive change will come from it.
And look, I'm cautiously optimistic, and I'll say that, right?
Okay.
Because we put up a post when he was going through the confirmation hearings. And it was and anybody who listens to this podcast knows when it comes to controversial and hate comments, I make Rich deal with them because especially when I was healing early on 5 years ago, I'm like, I can't stand the negativity. It affected me so much more with my nervous system. Like, Rich, I can't handle the hate. You got to deal with it, right? So I'd handle the happy comments and Rich would handle the hate comments, right? And now I can do it better, but it's just become our division of labor, right? I take boot camp. So we put up this post, not expecting much, and it was just him talking about Lyme disease. And it was a couple of realizations I had. Between all of our social platforms, it got over 1 million views. And I'm like, that's insane, right? It got over 1 million views. And it sparked a debate. And I think it was a political debate. And it was just so much Republican Democrat. But I'm looking at it as strictly from the standpoint of the Lyme community. And will this help us or will it make things better for America because of him, right? And I put in the post that I was optimistic and hopeful because he's had Lyme disease. His family has had Lyme disease. He talks about how his son was debilitated and still impacted by it, right? Bell's palsy, chronic symptoms, et cetera, et cetera.
Right.
So the first thing is, because it's so controversial, it's getting the visibility of so many people, which is putting Lyme on their radar. So, we're in an echo chamber, right? We do a post and it hits 99% chronic Lyme patients, but that one post probably hit 99% non-Lyme patients, which was wonderful because we're
Mhm.
getting awareness out there about Lyme disease. So that's positive, right? That to me is a positive aspect of this. But the other
Mhm.
aspect is the second video we put up of him was him, the emotional side of how Lyme has just destroyed his family and I think he even
Mhm.
said, nobody will fight harder for the Lyme community than me. And
Mhm.
I hope that's genuine. I'm not saying I think it
Right.
100% is, but it gives me hope, and the fact that it's being talked
Mhm.
about is a positive sign, and that's where I'm coming from here with some of
Mhm.
these things. So I'm just curious
Right.
to I'm happy to have this discussion with you, and again,
Mhm.
to your point, a lot of these things are things we've heard in the 5 years of doing Tick Boot Camp, things that help. Everything
Mhm.
he's discussing, again, the nutraceuticals, the
Right.
hydroxychloroquine, the ivermectin, the grounding,
Mhm.
right, the cut out the carbs, the
Mhm.
diet, exercise, mental health. These are
Mhm.
things that collectively help the chronic Lyme community and that have helped me personally.
Mhm.
So I'm all for those things. So I'm curious where you
Right.
stand in all that.
Yeah, no, absolutely. And I love the mental health aspect. I didn't touch much on that as well, but I encourage all because again, most patients come in with chronic pain. They're afraid to tell me when they have anxiety and depression because most of them have been told that their problem is anxiety and or depression. And so I always have to reframe it and I say, of course you're anxious and depressed because you're unwell. And so we can help you with that, but the anxiety and depression not causing your symptoms. You have infections that we need to treat, but that's why. And so it's very because again, most of them are being gaslit, and we haven't there. No one believes them. And I always say with Lyme, it's one of those illnesses. No, that you don't look sick, and so people don't know how to approach you when you tell them how unwell you are. Because a lot of people don't look sick. I mean, we have some patients in wheelchairs and things like that, so they have a visible, symptom of Lyme, and so that's a little bit different. But most patients don't, and people just don't understand it. And so the mental health component is so important, and the chronic pain. So I encourage
Yep.
a lot of work with sort of neuroplasticity. I
Which
encourage
is
this
your
app
favorite?
called I
Oh, I'm
encourage an
sorry.
app called, yeah, that's okay, called
Yeah.
Curable Health because it's easy. I know there are programs like Any Hopper and things like that, but I usually encourage people to do Curable Health first. It's easy, it's quick, it's an app on your phone, it's cheap. And so for people who aren't familiar with neuroplasticity or any, and how chronic pain kind of imprints in our brain, it's an exercise you do on your phone for a few minutes a day. Just start there. And so I do a lot of work in that sense as well with chronic pain, or I'll refer them out to a therapist who specializes in chronic pain and neuroplasticity and things like that. So that's also a really big component, and that gets introduced in phase one as well.
In phase one of foundation. Got it.
Mhm.
So we
Yeah.
had people that listen to this podcast regularly would know we had the founder or the co-founder of LymeDisease.org. Her daughter
Mhm.
was suffering from Lyme disease and couldn't get better. And she actually used neuroplasticity, specifically Annie Hopper's DNRS, at
Mhm.
the end. And after retraining the brain to break those, I'll say, neural pathways that were sort of like
Mhm.
stuck, right? She got better. So she now,
Mhm.
she's a huge advocate. This is Dorothy Leland, and we've had both of them on the
Right.
podcast several times. And so she's kind of like, we ask this question a lot. Where does it fit in our PARM framework? Where does DNRS
Mhm.
and where does neuroplasticity fit? And I think it's at the foundation in your model or the prehab in our
Mhm.
model, but also at the maintain level as well, because, or maybe even the
Mhm.
recovery side, depending on what specifically is going on in your body, right? Because
Mhm.
if you treat it and somebody's listening and saying, I've done all the things and I'm still sick. Well, we've had people tell us, hey, neuroplasticity got me better because I did all the things,
Mhm.
but my brain, and it's not your brain, it's not you, it's not you as a patient that
Mhm.
there's something wrong with you. It's your brain pathways, your brain chemistry is altered from the illness. And these
Mhm.
neuroplasticity programs will help rewire the brain. I look at it like as an IT professional, you're rebooting the brain, right? You take a factory reset of the brain
Exactly.
so you can go back to
Mhm.
a normal brain pathway, which then brings symptom relief and quality of life improvement, right? So
Mhm.
you do it at the foundation, but you think there's benefit to bring it in later on as well if people have done all the things and they're still looking for something to try to help?
I think there's benefit to doing it all along. So if you're somebody who engages in something like that and you see benefit, then you know that is something that you'll likely have to continue to do down the road. So it's something I do encourage people to continue with. And I always say it's a gift that to discover that we can rewire our brains in that way. And it's something that's so easy to do. And I like to do it in the beginning because it helps to determine effectiveness of treatment if we start that early. So it'll just optimize or enhance your treatment as we go. So I will ask them to do that in phase one. But interestingly, that is the hardest sell, because when you tell people, when you start talking about the brain, they automatically, it's a trigger. Because I mean,
Yep.
with Lyme disease, there's a lot of PTSD because of how frequently people have been dismissed. So when we start saying, it's in your brain, in your head, it's an immediate like stonewall. No, it's not in my head. And I was like, okay, so let me be very specific in how I'm saying this. The pain is real, because they think that what you're saying is that you're making up the pain. No, your symptoms are real. It's not that they're fake. They are real, but your brain has mapped itself for pain. So when we treat infection to get rid of the pain, the brain is still going to be firing pain signals even when the pain is gone. And I'll often use an example. I use the book The Power of Habit by Charles Duhigg. He has a chapter in there that talks about how our brain works and how memory works and why our brain has the ability to do this. So the things that we do every day, your brain doesn't want to have to actively remember how to do it. So when you start your car, you don't have to actually think, okay, I have to, insert my key or push the button, hit the brake. Your body just does it. You've done it enough times. There's a pathway in the brain. Your brain it's in your subconscious now. You just get in your car, you start it, you go. You don't have to think about it. And that's what the brain does to save energy. So we're not consciously actively trying to remember how to do something. And so they look at people who've had brain injuries and things like that. And they took an example of a man, I believe, had a stroke. And they would say, so, tell me where the glasses are in your kitchen. And he couldn't tell you. But when he needed water, he could walk to the kitchen and get a glass. So subconsciously, his body knew the pathway to go and get it. And that's kind of what pain does. When you have this repeated pain over and over and over, it maps the pathway in the brain. And it just goes into your subconscious, and your brain thinks, I'm not safe, because that's what pain is telling us, we're not safe. And so this I'm not safe pathway becomes mapped in our brain, and we just keep firing pain signals. So when we remove the thing that makes your brain think you're not safe, the pathway is still mapped. So even though the initial trigger is gone, you're still firing the pain signal. And that's what we're trying to fix. That's what we're trying to rewire. We're trying to erase that subconscious part of the brain that's saying, I'm not safe, I need to fire pain signals. And that's why I want people to do Curable Health, Anti-Hop, or whichever program works
Yep.
for them.
What was the first one you said? I'm sorry. What was the name of the program you're recommending?
It's called Curable Health.
Curable Health. Okay, got it.
Curable Health, and it's much cheaper, and it's not as intense as some of the other programs. So I find that that's a good soft intro. It's a good place to start for the people who are a little apprehensive and they don't want to commit to a higher amount or such a large investment of time with some of the other programs. And it's an app. It's on your phone every day. Just do a couple exercises. Go outside, stand in a forest, go for a walk, and just do a couple exercises on your phone. And so it's a very soft intro, and I find that that's an easier way to introduce people to it. But I do usually encourage they do both, because the programs, they work in different ways, they offer different things, but that's often where I'll start.
So I do want to say, for anybody listening who wants to learn more about these neuroplasticity programs, in addition to Curable Health, we've had all the leaders on. We've had, DNRS, we've had the Primal Trust, Dr. Kathleen King, who I don't know if you know her, I was fascinated by her. She was brilliant. Kathleen King, who's the Dr. Kathleen King, who's the founder of Primal Trust. We've had My Vital Side, Lindsay on. We've had Ben from Reorigin. So each thing I'm saying is a podcast episode people can find to learn more, and there's specific targeted interviews with founders of neuroplasticity programs that are designed for this specific thing that people can go find more on if they want to learn more about neuroplasticity. I do want to ask, before we close out this framework, where do you fit, because we talked on it, because you mentioned where you fit neuroplasticity in your 4 tiers. Where do you fit the hydroxychloroquine and the ivermectin treatments into your 4, foundational steps in Lyme treatment?
Usually that comes into the prescription phase. So that'll come sort of into the phase 3. So those get saved for later.
Yeah. That makes sense. It makes sense. And then if you can quickly, I know we've had you for a while, can you just touch on your maintenance phase? Because we didn't even talk about your 4th phase, which is your maintenance. Can you just give us a little bit of a background and description of that?
Sure. So maintenance phase. So what we'll do is when somebody if they're on antibiotics, when they stop, I have them continue botanicals for 3 to 6 months. after that. So that's kind of like a taper off. So when you stop the antibiotics, I want botanicals, and we're kind of continuing some of those foundation phase things for a little bit longer. And then the maintenance phase is just being cautious and aware and conscious of the reasons you became symptomatic in the first place. A lot of the people, and it's interesting, a lot of my female Lyme patients are type A. I'm also type A, so that is not, a shot at any of my patients. But it just lends itself to a very high stress, fast paced, not a lot of sleep, go, 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 go type of day. And that does not serve you. And so there is a very big focus that has to go into lifestyle management. You have to know when to shut it down and take a break. And so that's kind of the primary thing in the maintenance phase. So we're eating well, we're exercising, you don't have to be doing CrossFit, but we're moving our bodies, we're doing some light weights, things like that, healthy diet, but you don't have to be crazy and as strict as you were before. At this point, you shouldn't have as much of a negative response to certain foods as you did at the beginning. So you should be able to introduce some of those other foods that, before were a big trigger of symptoms. So it's just being conscious and cautious and understanding when you're pushing your body too far and how to support your body. And so then I'll say, if you're in a period of stress, make sure you take a break. If you're not getting enough sleep, you cannot go multiple nights in a row on a couple hours of sleep. You have to stop and get your sleep. You can't let your lifestyle tank your immune system again. And for people who had mold, for example, sometimes they'll say, every year we're just going to do a quick 4 to 6 week detox. I'm not going to make you pay all the money to retest the mold, but we're just going to, pull your mold protocol back out. You just do that once a year. It's whatever was on that plan, just do that again. That's it. It's not, we're not making you do it for months because the initial mold protocol might have been a year. It's just 4 to 6 weeks. Just pull those things. You probably still have bottles in your cupboard. Just pull them all out. So kind of maintenance phases to prevent accumulation of toxins. Making sure you're very focused on habits, the healthy habits, so you don't, tank your immune system all over again. And so those things I think are very, very important focuses in understanding when you're pushing your body too hard or too far, or when you're entering a phase where you're likely to trigger those things. So an example for me, I've had 2 babies since I had Lyme, which is also interesting because a lot of women are very afraid that about transmission of Lyme to their babies, or that they won't be able to get pregnant. So that's a conversation I have quite frequently with my patients. I have a 2-year-old and a 5-year-old. I breastfed both of my babies, which is again another big question. But when I had my baby, my first daughter was a very traumatic birth. We almost didn't make it, but we're both here, which is great. And then so recovery from that was pretty intense. And then you go into mom mode with a newborn, where you are not sleeping, you're waking up every 2 hours. And so I was convinced I would have a Lyme flare after I gave birth, but I didn't, because I was very active and conscious, and I was not that mom who was going to be a martyr. When I needed help, I asked for it. If I needed to sleep, I would sleep in the middle of the day and ask someone to come over and sleep. I would just do the things I needed to do, because that's easier than getting Lyme again. I do not want those Lyme symptoms back. It was terrible and debilitating, and no thank you. And so I will do what I need to do now for that to not happen again.
That was okay. So I have one more follow-up question. I know we've talked about a lot. So obviously I'll kind of tie everything together. You had your first complex chronic illness patient. You started, consulting with Horowitz, iLads, mold specialist. Here you are today. You've treated over 1,000 Lyme patients. You're now affiliated with iLads. You are a Lyme expert in the Lyme community, but you also, in the middle of this, while being a Lyme specialist, contracted Lyme yourself by helping a patient. Can you share that story? Because I think that's really a really powerful story to share.
Yes. So my best friend from university, we were roommates in university. She's also a naturopathic doctor. She contracted Lyme disease. She had to, shut her practice down. She essentially moved into the forest, built a tiny home in the forest. She had really, really severe EMF sensitivity, had to get rid of her phone, her computer, batteries, everything. And so I would visit her weekly. And, we had sort of a rotation with sort of a few other friends, her parents, her sister, where we would take her food. She'd handwrite notes, we'd take pictures of them and kind of text them to other people when we left, but we couldn't take our cell phones into into her tiny home as well. So she lived essentially in this tiny home in the forest for about I want to say a year and a half or 2 years. And so while she was there, I actually, before we knew she had Lyme at that point, I thought, this might be Lyme disease. So we're doing blood draws in the forest for all of the testing, and then taking treatment to her in the forest to treat. And about a year after doing that, I got sick. Um, and so I had been treating Lyme at that point for about 5 or 6 years. And it took me a year and a half to diagnose it in myself, just because of the complex nature of Lyme and Lyme symptoms. I was in the thick of it. I was seeing Lyme patients every single day. And it took me a year and a half to diagnose it in myself, because again, Lyme is, I mean, it's not easy. It's just the way the symptoms present. Um, I used to walk around joking when I was sick. I'm like, oh, watch, I have Lyme, ha ha ha. Watch, it's Lyme disease, ha ha ha. And then, a year later, I thought, okay, I'm gonna check myself for Lyme, because I was really sick, and I was the most positive for the of any patient we'd ever treated, and I was positive for everything you could test yourself for. So, so that was a nice revelation, and then I started my own sort of treatment from there.
Did you use your healing framework, the foundation, natural treatment, antibiotic treatment, and maintenance? Did you follow through that path?
So I did. And so, well, it was interesting because I was so sick, but also already a naturopathic doctor, I had already started implementing other things to manage these weird symptoms.
Mm.
And so my first symptom was just fatigue, and I worked a lot, I traveled a lot. And so I thought, I'm just run down. It's chronic fatigue. I can take the whole month of December off and just sleep. And so I slept for the whole month of December. And then in January, I was like, I'm still exhausted. And I went from, working out, 2 hours every day. And so that was kind of the December. And then by August of the following year, one day I realized I hadn't worked out in months, because the mere idea of going to the gym was so exhausting. I couldn't even like get myself up to go. So I went from doing, Muay Thai and all of these things to I just couldn't go at all, not Pilates, yoga, nothing. Um, and then my symptoms were really interesting. So I started to, it's a classic story. I started getting night sweats. I thought it was stress. So I started taking some adrenal support. And then I was sick all the time, like all the time, sore throat all the time. So I started taking botanicals and doing IVIC to support my immune system. Why is my immune system why am I sick all the time? I'd be healthy for a week and then sick again. And then I started getting heart palpitations, shortness of breath, air hunger. So then I saw a cardiologist, and I was fine, and there was nothing wrong with me. So I started
But
taking
you're a Lyme doctor.
cardiovascular,
How did you not see the
right?
writing on the
How did I
wall?
not see it? How did I not see it? And they all kind of like I had the classic Lyme symptoms, and then I ended up I have a pretty high pain tolerance, and to put that into perspective, I had jaw surgery where they had to, I had my jaw used to lock open, and 3 days in, I asked them to up my pain meds, and they told me that they weren't giving me any. And I was like, well, if I haven't taken any pain meds, why start now? I didn't take any pain meds. I've had 2 C-sections. I didn't even take Tylenol after. I was like, I'm fine after the epidural wore off. So just putting into perspective that I have a weirdly high pain tolerance for some reason.
Mm.
And so one day I was at home and I started to experience facial drooping and facial pain so severe I was crying on the floor at home. And that's why I share those other stories, because my pain tolerance is quite high, and I was crying from the pain in my face. And my sister's like, you need to go to the hospital. Like you need to go immediately. So I went to the hospital. I thought I was having a stroke, and I had a doctor come up to me and pat my leg and say, honey, like, why are you really here? And I like just,
Did you punch him?
I wish, right? And like that was my first emerge visit. The second one was because I was passed out from the air hunger. So like the symptoms were very classic. I had the muscle twitching and like numbness and tingling in my baby fingers. Like just I also got visual snow, which is a less common symptom of Lyme, but I have a few people who tell me they get the visual snow every now and then. So visual snow was a big one for me that would kind of come and go. So I was treating symptoms for a full year before and so I think that was why I didn't test right away, because I'd get better and then worse and then better and then worse. So I was treating, but I wasn't specifically treating. I was almost like not, just symptom treatment. But all the botanicals I was taking were helping. So I was taking those anti-inflammatories, I was
Yeah.
taking antimicrobials. I just wasn't taking the right ones. But I think that that's why I was able to work. I didn't have to stop working. Like my symptoms were severe, but I was still functional. I was taking a lot of things for cognitive function, and I was keto already. I was intermittent fasting already. I'm gluten free. I'm lactose intolerant. So those are things that were just naturally out of my diet. And so I think all of those things are why I wasn't completely debilitated, but I was still very sick. And so then when I did the test, um, and got all those results back, I was in a little bit of shock. I'm not going to lie. But I was grateful because I knew exactly what I needed to do. So I tweaked my protocol, changed my protocol, switched up all my botanicals. I have a picture of all of the stuff I took, and I probably took about 5 times more than I give my patients. But my tolerance was good. I didn't hurts when I took things, so I was just like down it goes. And so I have a picture of my kitchen where one whole corner of my kitchen is just all bottles of pills. I was just on, it must be like 50 bottles, maybe more. And then I introduced the antibiotics after that, and I did about 6 months of antibiotics. Stopped the antibiotics, continued on the botanicals, and I stopped the antibiotics when I was pretty much symptom free. And I would say I've been symptom free since then. So my treatment was mostly natural, mostly botanical, but I do think it was the antibiotics that sort of took it over, took me to that next step and really eradicated the rest of my symptoms. So the antibiotics for me were an essential part of it. But I only needed to do them for 6 months, and then botanicals from there. And then I didn't take a pill for about a year after that. I couldn't even bring myself to swallow a fish oil. It was just the number of pills that you swallow through this process. So I think it's funny it took me so long to diagnose it, but I'm grateful for the knowledge I had before I knew what I had, because I was treating myself, I just didn't know. And then I was grateful that I knew what to do when I got the diagnosis, because I think that the biggest problem is that people get diagnosed and then they can't find treatment. And so they go years trying to find somebody to treat them. And so I'm fully aware that I'm fortunate that I was able to I knew exactly what to do, knew what I needed to do. I was right where I needed to be. And so I had access to what I needed. So I'm aware I'm very fortunate in those circumstances. But again, still very interesting. It took me just over a year to diagnose it in myself. And I had, like we said, classic Lyme symptoms, like classic.
Yeah, I mean, on the flip side, though, your thousands of patients are fortunate to have you to help them heal too. So it's twofold, right? It's you are fortunate to have the knowledge, but your patients are fortunate to have you as a doctor in Canada to help them heal, because frankly, there aren't enough Lyme litter doctors in the world, never mind in Canada. So that's the flip side.
Right. Well, thank you for that. Yeah. So it is helpful because I can at least say I understand what what I'm saying, and then I also I think it's helpful to know that there is healing. And I one of the things at the forums I always tell patients, and you have to take them with a grain of salt, because a lot of people there haven't found their path yet. They haven't found their provider. They haven't found the treatment. So a lot of them are still really sick. And so it's hard to read that, because patients read that and think, oh my goodness, this is going to be me forever. And no one has a golden, I don't have a golden ball. I can't tell them, or, what's going to happen, but that doesn't have to be the outcome. So I always tell, there's so much great information from other patients, other people with Lyme, but know that there is, there can be a light at the end of the tunnel.
Yeah, and I think that's such an important message, which is, I mean, look, I was there for years where I thought, I'm broken, I'm damaged, I can't get better. And it's not true, right? It might not be easy. It might require some trial and error, but you can feel better and you can get yourself in a better place. And I think that's really important. And that might be triggering to people as well listening to this podcast. But it's an important message, because if I didn't hear that and get triggered over and over and over again, I wouldn't have taken the steps to get to the place I'm in now. And therefore, I would have been stuck in this chronic pain, chronic illness state that was just horrible to be in, right? So I think it's an important message to receive, even if it's triggering. So Why don't you tell us, Dr. Andi, what you're doing now? Because you've come full circle again, as you kind of hinted at all along, where you were going to medical school, you pivoted to natural becoming a naturopathic doctor, and we talked about the limitations of being able to prescribe medication. And now it sounds like you're doing something to further advance your career and specialize even more, which I'm not sure that's even possible with all the knowledge you have. But what are you doing today to even bring your career to the next level?
I am currently back in school. I'm in medical school to become a medical doctor. So I have come full circle from my goal as a little 3-year-old, not being a singing brain surgeon. But the medicine is, and so I'm now back in medical school and I'm in my second year. And just sort of finishing up my second year, and we'll shortly move into clinical rotations. And I actually, it's a lot of work, but I guess because of my experience and my background, I'm so excited every day at what this will allow me to bring to my patients. So I'm so excited to be able to bring the ND and the MD side together and offer that, and how that will help the Lyme community and my Lyme patients to be able to do all of that. So again, it's a lot of work, but I love it. And it's really, I'm really excited to finish. I can't wait, essentially. I wish it could go faster, but.
All right. So to wrap up this interview, I do want to ask you one more time to share how people listening to this podcast can contact you, whether they want to just go consume your social media content, whether they want to work with you as a doctor, either in person or virtual, or just to see what you're all about in some written text. Where can they go and how can they learn more about you?
So you can find me at drandnd.com, and that's Andi with an I. Or you can find me on Instagram or Facebook at Dr. Andi ND.
Well, Dr. Andi, I can't thank you enough for this brilliant podcast. I mean, this has been, I think, a full 2 hours on the recording here, if I had to guess. And, I worked all day. As you know, I was late to this podcast interview and I had to ask you to delay it a half hour. And I am energized from this discussion. So I can't thank you enough for joining our Tick Camp podcast.
Oh, thank you so much for having me. I'm so excited just to share information and, provide as much as I can to, again, the Lyme community. If it's helpful to anyone or give somebody a new idea, a pathway, an avenue, a route to try, then that's wonderful.